medical school, not a lot of time was spent on gout. Certainly when I went to medical school, there was very little time, and from what I understand, it's still a small amount of time. Secondly, gout is often shadowed by the other diseases that patients with gout have. Gout has a lot of comorbidities. Patients get things like obesity, coronary disease, kidney problems, heart problems, high lipids, and often the visit gets overshadowed by all those other problems rather than the gout. So often primary care docs just don't have the time to think about the issues of gout, and then sometimes that leads to patients not getting all the medication that they need. Well, I think it's important. We certainly, our group, with the rheumatology group at Hospital for Special Surgery, and we believe that it's really important to educate primary care doctors. For example, I do a session with, we call the junior residents, the second-year residents at New York Hospital, and I spend this long session with them. We spend an hour and a half, plus before that they have articles to review. After that we give them things to review to try to really bring them up to speed on the latest things in gout. And when we finish the program, we really think they all are going to believe you've got to get less than 6 when you're lowering the uric acid. They believe that gout is a chronic disease, that if you don't get at it and get that uric acid lowered, the patients are just not going to do well. So we really try to reverse the fact that primary care doctors often don't have the education. We try to speak to primary care doctors whenever we can and try to get the message out, because a big principle of gout is that there's 8.3 million patients with gout out there, and there's not nearly enough rheumatologists to take care of them. So most of the care of gout is going to be done by primary care. So it's really important that the message gets out about what's available, what the long-term outcomes of not treating patients with gout is, and what the long-term outcomes are of treating the patients properly. And the message we want to get out is that gout's essentially a, quotes, curable disease. If you can get that patient less than 6 and keep them there, then the patients tend to do great. After a while, the attacks just go away. The patients do fine. But left alone, it's a chronic progressive disease, and it tends to get worse, and they get more attacks over time. Right. Well, we certainly want primary care doctors to be very aware of what's special about gout. One of the things is how rapidly it comes on. So if someone has a pain in the toe that comes on very slowly, you'd be a little suspicious. Maybe it's something else. Gout tends to be explosive. From the time that it starts to the time that it becomes 10 out of 10, often that's 3 or 4 hours. The patient classically can go to bed at night, wake up at 2 o'clock in the morning with a hot red toe, can't even put the sheet on it, and that happens very, very rapidly. So we try to identify that as one of the key features. A red joint, that's pretty typical of gout. Certainly the involvement of the bunion joint, the first MTP joint, that's pretty classical for gout. And of course checking the uric acid and seeing that it's high. Patients having recurrent episodes in the same joint, that's typical of gout. There are certain situations where you really can't be sure. An example would be a patient comes in with let's say an elderly man comes in with a swollen knee. Even if his uric acid is high, you can't be sure that it's gout. It could be pseudo-gout, calcium pyrophosphate crystals. So in certain circumstances, we really encourage primary care doctors to be comfortable with aspirating the joint or making sure the patient gets aspirated so that the crystals can be looked for. There are certainly circumstances where they can make the diagnosis without crystals, probably the majority of circumstances where the picture is so clear and so typical of gout that you can make the diagnosis, but there are times you really need to see the crystals to make the diagnosis.